Hi, everyone. I'm Dr. Joe Court from the Center for Relationship Health in Royal Oak, Michigan. And today I'm going to introduce you to one of our therapists, Erica McMurtry, and she is going to go over her top three specialties with us. Hi, Erica.
Hi, how are you?
Good. How you doing?
Good, good, good.
All
Hmm.
right. Let's do your first specialty.
Okay, so my first specialty is EMDR therapy. So I am a certified EMDR therapist, and EMDR therapy is used for people. Well, let me explain. So it is called eye movement desensitization reprocessing therapy. So EMDR therapy is used for individuals who may have PTSD, who experience trauma, depression, anxiety, OCD, and grief and loss. So it covers the span of mental health disorders. So with this therapeutic modality that I use, we typically use eye movements, and eye movements mimic REM sleep. And in REM sleep, that's when our memories get processed. And sometimes when people experience traumatic events, um, the memory may get stuck. So you may notice like you start to get triggered. You may feel like your past is continuing to like haunt you, or you're still, smelling smells, or you have like body distress based on certain sounds you hear or people that you see. So with EMDR therapy, it helps you to reprocess the events that has taken place in your life. So if it's distressing you now, what happens is that EMDR therapy will help you to lower your distress levels so that you can actually continue to live a prosperous life where your past won't continue to haunt your future. So that's EMDR in a nutshell.
All right. Thank you so much. And now your second specialty.
Okay, so my second specialty is actually Christian counseling. So I know that people think, oh, pastoral counseling, Christian counseling. So I decided to go into to become a therapist because I know that a lot of people actually count on their faith leaders to provide counsel to them. But faith leaders aren't necessarily, well, they may not be trained to be a clinical counselor. So a clinical counselor can help to basically bridge the gap. So I'm bridging the gap between your faith and then also the mental health. So whatever you've been diagnosed with, whether it be depression, anxiety, trauma, I incorporate the spiritual aspects of it, the discipline. So whether it be you want to incorporate prayer, meditation, scripture, whatever you would like, I take a person-centered approach. So I follow your lead and I incorporate those the strength-based approach for that. So whatever you would like, I incorporate that into the session so that you can get the healing that you would like to have.
Mm, thank you so much. All right. And your third specialty.
Okay, so my third specialty is sex therapy. So I know that may be an oxymoron with Christian counseling and and having sex therapy, but God told us to be fruitful and multiply. But with this, I was so excited to be able to go to University of Michigan for their sexual health certificate program. Um, in this, I swear, I kid you not, the program was so great. I've learned so much. And under the auspice of you, Joe Court, thank you, Dr. Joe Court, thank you for guiding me in the ways of the sex therapy way. So thank you so much. So for this with sex therapy, I actually assist if it's female disorders, men's disorders. So if it's erectile dysfunction, with females, I've worked with vaginismus, or if it's issues with the couple. So if there's some desire discrepancy, or if there's some libido issues there, or if there's some pain management issues that are going on. I help, individual and at the couple level. I know a lot of times people are like, oh, it's about sex, but it's about the entire person. So mind, body, spirit. So it's all interconnected. So I'm here to help you to meet the needs and improve your intimacy with yourself and with your partner.
Thank you so much, Erica. All right. So if you would like to work with her, you can call our office at 248-399-3776. 7447. Or you can go to our website at www.crsh.com. Thank you so much for listening, and we hope to see you soon.